Hey, in this video today, I'm going to be answering our most commonly asked questions about meniscus injuries. We make a ton of videos about meniscus problems. If you want to check more of them out, you can go down in the description below and find a playlist that's all about our meniscus exercises, tips, and advice. But we get questions all the time from people who are suffering from medial meniscus injuries, posterior horn meniscus injuries, lateral meniscus injuries, and anterior horn meniscus injuries. If you've ever heard of these terms, you've probably had an MRI and the doctor told you that you've got a meniscus problem, and they're just talking about the specific part of the meniscus. There's the medial or the inside meniscus, and then the outside meniscus or the lateral meniscus, and then the front end of it and the back end of it, that's the anterior horn and the posterior horn. That's all they're talking about. So just in case you're confused about what all that means, they're just telling you about the location of the injury on your meniscus. My name is Dr. David Midoff, and I'm a specialist physical therapist at Paso Manual Physical Therapy. And this channel is dedicated to helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and medications. Please consider subscribing to this channel so that you don't miss out on any of the helpful tips we post every single week. And we help out people physically in the clinic with all sorts of meniscus injuries, all the ones that I've mentioned before. So we see them all the time, and we see most of them recover just fine and get back to everyday activities, including things like running, jumping, exercising, lifting weights, and they're doing it safely despite having had a tear or an injury in their meniscus. One of the most common questions we get is, how long does it take to heal? Now, what you got to know about the meniscus is it's the second slowest healing tissue in the body, second only to discs in the spine. All the way up in the neck and into the low back, you've got discs, and they're all made out of a certain type of cartilage. And the tissue that makes up your meniscus is very similar to the tissue that makes up the spine discs. And so it takes a long time for it to heal. It just doesn't have the best blood supply. It's what we call low metabolic tissue, meaning the cells are just moving real slow. So they heal real slow as well. They're designed to act as cushion and shock absorption for your knee joint so that you can walk and run and jump and do all the things that you're supposed to do. If they become torn, they can heal most of the time. And at the very least, it can become less irritated and able to tolerate your normal everyday activities despite you still having a tear. And it might be enough for you to avoid having a surgery altogether. But as far as the time, it ranges. It varies depending on how severe it is. If you've got just a minor injury to your meniscus, you're looking at 3 to 6 months for it to recover 100%. And if you got a full-blown tear, you're looking at closer to a year, 6 to 12 months for that to recover. And now tears, I've never seen a tear heal itself naturally, where the part that's torn off comes together and reattaches itself on its own. We don't have evidence of that, which doesn't mean that it doesn't happen. It means that there's a possibility that it happens. There's just no scientific evidence. There's no scientific studies that have been done to prove that it happens. It's a possibility though. What we do know is, just like if you were to cut your skin open and it bleeds and you have to go through the healing process, when your skin heals, you develop a scar, and there's a visible scar where you had your injury. That's what can happen inside the meniscus. And so it despite there being a tear probably still visible on an MRI, even years later, it might still be there, but it may not be bothering you. You may have a pain-free knee, and your knee joint might feel just fine, but your meniscus is now not irritated. It's feeling just fine, and you can get back to activities just like you did before. You do have to figure out what caused the tear and solve that root problem. Otherwise, you're going to be re-aggravating that tear and making it worse over time, or creating another tear somewhere else or in your other knee. So it is important to find that root problem so that you can successfully escape having a meniscus surgery. And if you get a meniscus surgery, the same timeframes apply. You're probably going to deal with the longer time frame, 6 to 12 months, which is important. If you had a meniscus surgery, surgeons often will say, "Oh, you'll be fine in 2 or 3 months." And you have to realize that surgeons aren't doing the rehabilitation. Physical therapists typically are, and those timeframes don't work. People usually take 6 to 12 months. You got to double or triple whatever the surgeon tells you as far as recovery times. Now you'll be walking mostly at 2 or 3 months, but it's going to still swell. It's still going to flare up. You're not going to be able to exercise normally. It's going to be very light exercise that doesn't aggravate your knee. Otherwise, it's going to swell up on you and you're going to stay injured and cause more problems. So you got to take your time with the recovery and plan for at least a year. As long as you're doing everything right, you should get back to normal after having a meniscectomy or a meniscus surgery. The next common question I get is, will I be able to run or lift weights or do squats? Will I be able to get back to some vigorous exercise? And the answer is most of the time, yes. In 9 out of 10 cases, 9+ out of 10 cases, as long as you're doing the right things for your meniscus, you should be able to run, jump, do squats, lift weights. You've got to fix the muscle imbalance. So typically, most of the time when we see people with a meniscus tear, they've got over-dominant quads and they've got weak glute muscles. And we talk about this at length in that knee meniscus help playlist that I talked about. If you go down there and check out the playlist for our knee meniscus videos, you'll get more information on the imbalance that I'm talking about. But if you don't fix that imbalance, it causes excessive pressures at the knee joint on the meniscus. And if you try to go exercise without having fixed that imbalance, you're going to re-aggravate your meniscus problem. You're going to tear it further or create another tear somewhere else. And even though you may have already improved and felt better, it's just going to come right back because the underlying root problem is still there. But if you rehabilitate your knee properly by fixing the muscle imbalance, and you give it its due time, the time that it needs to heal, then you should get your meniscus to actually get more dense and healthy. Just like you work out your muscles and if you do it right, of course you can overdo it with exercise and injure yourself, but if you work out the right amount and you give yourself the right amount of rest, your muscles will get firmer and more toned and even bigger over time so that they can better lift more weights or tolerate more forces. Same thing with your meniscus tissue. If you load it appropriately, if you give it its time to rest and recover, it becomes stronger and more dense so that you can take more running and jumping and squatting and all these exercise activities. You can get back to that just fine. The next most common question I get is, will injections help? And I've been asked about all different types of injections: cortisone injections, PRP, prolozone injections. There's all kinds of things, stem cells. And to give you the short answer is cortisone injections specifically, those are the most common done exercises, commonly done injections. That's a pain reliever and anti-inflammatory medication that's injected into the knee. It is pretty good at reducing the pain. It's pretty terrible at fixing the root problem. It's not going to make your muscles stronger. It's not going to make your knee joint move better. It's just strictly a pain reliever and anti-inflammatory. And what we know about cortisone is after you get the second, third, fourth, fifth shot, it damages connective tissue, which is what meniscus tissue is made from. So doctors will typically limit you on having 3 of those injections per year. And if you decide to get one, you need to be doing some exercise program or you need to be on some program of some sort to make sure you fix the muscle imbalance so that you're not, so that you take advantage of the time that you're getting some pain relief to do some exercise and put your knee in a good situation to heal. And just a quick side note, a shameless plug here, we've got a 28-day knee health and wellness boost program. It's a 28-day program guided by me. I'm teaching you all the exercises and processes and advice that you need to know to rehabilitate your knee's muscle imbalance problem. You can find the link in the description below to learn more about that. But that's what you would use the cortisone injections for. It's just a pain reliever. Now, when it comes to prolotherapy, PRP injections, stem cells, we've actually got another video that talks all about that. Those are all known to be mixed in the results. So they may help some people, they may hurt some people. You can go check out that video for more details on exactly what each one does and whether or not it's a good idea for you to get it. It may be a good idea to get it. Again, none of them fix the root problem. You still have to fix that muscle imbalance. Another question that I get commonly is, should I use an inversion table? Should I hang upside down? An inversion table is this device where you hook your feet in by your ankles, and then the table flips you upside down and you're dangling upside down by your ankles. And the concept is to unload your body against gravity. And sometimes people will do this for knee problems like a meniscus problem because they know that in the spine it takes pressure off the discs. And what I found with this is it might benefit you. The problem with it is you're hanging upside down. Not many people can tolerate that for very long. Typically, people can take it for a few minutes, maybe 2, 3, 5 minutes at most. At the longest, I've seen people tolerate there about 10 to 15 minutes, and all the blood rushes to your head, all your boogers and snot in your nose goes up in your eyeballs. It just is not an uncomfortable feeling for most people. Some people can endure it and they're comfortable there, but the benefit of the unloading is only there while you're upside down, because once you go back up, you're back on your feet and you're back to the normal gravity situation that you're in. The pressures come back into the knee joints. So I would still say, it's fine if you want to do it, but don't rely on it to fix your meniscus problem. You've got to go fix that muscle imbalance, because when you offload the quads and you get more strength in the glutes, every step you take now, every exercise you do is going to come from an unloaded position in your knee without you having to flip upside down. So that really is the best long-term fix for you over using an unloader. But it's not wrong. You're not going to hurt yourself as long as you can tolerate being upside down and the machine is safe and well put together. You should be fine to hang upside down if you choose to do that to help your meniscus problem. We recommend people start with an exercise called tailgate swings, and you're just sitting on the edge of a table or a bench or somewhere where you can dangle your legs and swing them. A computer chair is what we talk about often. And we get questions about this exercise all the time, like, should I add ankle weights? Should I do it faster or slower, or move farther, or move a little bit? And to answer this question, I have not seen weights like ankle weights be a big benefit to it. Some people report that they feel better doing it. It's not going to hurt you to do it as long as the weights aren't massive, 15, 20, 30 pound weights. You should be fine. That'll be tough to get off and on anyway. And the idea with that is you're trying to traction or put some space in the knee joint. You can give it a shot and try it. It shouldn't hurt you to do a little bit of weight. But the point of that exercise is that gradual motion. As long as it's not too aggressive, you got to just try it out and see how far you feel comfortable going and how fast you feel comfortable going. But you should feel benefits after doing that for a day or two. If you're doing that tailgate swing at a pace that's comfortable for you, you might try different speeds and different distances as far as how far you move your legs. You should notice if it's going to help you or not within the first day of doing it, or 2 days at most. If you don't feel an improvement in your pain, and the way that it should come off is you should be able to stand easier, you should be able to bend your knee a little bit farther or straighten it better. It should just feel like it's 5% better, maybe 10% better. And as the days go on of doing that exercise, then you should get even more improvement over time. The problem is making sure that you're consistent with it. It's not enough to do that exercise for a minute or two. You've got to be doing it for 5 to 10 minutes several times a day. Cumulative throughout the day would be great if you can get up to 30 to 60 minutes or more, because you're moving the fluid inside the joint when you do this. And because the meniscus is not it doesn't have a good blood supply. It's not a vascular, is what we call it in the medical field, a highly vascularized tissue. It just means it doesn't have a good blood supply. It doesn't get nutrients to it very well and doesn't get the waste products taken out, which is important when you're healing. You generate a lot of waste from the cells. So the way that it gets nutrition is from the fluid, the synovial fluid, or the joint fluid that's inside the joint. And that synovial fluid is not circulated by your heart like your blood is. Your heart's pumping and it shoves the blood around through your body and gets it to move. The way the joint fluid moves is through movement inside your knee. So if you're not moving inside your knee, you're not getting circulation of that fluid. So that tailgate swing is great for that. The thing is, you just have to be doing it consistently so you get frequent movement. And that joint fluid is created on the inner linings of the joint capsule, of the membrane of the joint. So that's your closest connection to the blood supply, to getting the waste products removed and the nutrition brought in. So circulating that fluid is just critical. You need to do that if you've got a meniscus problem. The next most common question I get is, will a brace help, or especially an unloader brace? And here's my answer to that. For a meniscus problem, a brace may or may not help. It's not required though. Unless you've got a ligament issue, which is separate from a meniscus problem, it's probably not going to make a big difference. Now, a ligament issue would be like an ACL tear or a stretched ACL. We call it a lax ACL, an MCL, an LCL, or PCL. You can Google all those terms. They're all ligaments, or would hold the bones together. They're not cushion tissue. They're connecting tissue. Those are critical. If those are injured, it's critical to have a brace on. As uncomfortable as it might be, you just need that extra stability so that you can get around and do your daily activities without aggravating your ligaments more. But if you've got a knee meniscus problem, then a knee brace isn't required, but it may be beneficial to you. You may decide to wear one. You can try one, and whether you use the one that's just a sleeve or the one that has the brackets on the side that keep your knee straight, you'll have to do some trial and error and figure it out. The way to use a brace, though, is if it does benefit you all day, use a brace over taking pain medications or going to go get injections or talking to a surgeon. If you can wear that brace and get some pain relief and you feel better, it doesn't swell, you're generally improving over time, then go for it with the brace. Now, we have a lot of people, though, that try the brace and they're like, no improvement really, actually kind of hurts me even. I don't feel like it makes a big difference. Then forget the brace. You've got to be working on that muscle imbalance, though. And even if the brace does help you feel better, the muscle imbalance needs to be fixed. The brace will not make your glutes stronger. It will not allow your knee joint to move with better quality. That's fixing the muscle imbalance. That's what that will do for you. Okay, we got a few more questions. The next one is heat. Will heat help my knee? Again, it's kind of like the knee brace in that the heat may make your knee more comfortable. It may loosen up the joint a bit, which is beneficial. Absolutely use it for those benefits. But as far as healing your meniscus and making it go faster and feeling better, it may not make a big difference. You still need to give it its due time. It needs 3 to 6 months on the short end, 6 to 12 months on the long end. Heat might just make it a little less stiff when you wake up in the morning or to move after you've been sitting for a while. Especially if it's cold out and your knee stiffens up quite a bit, put heat on it. It's better than taking pain medication, ibuprofen, the stuff that tears up your insides, your stomach lining and hurts your kidneys and your liver and other organs as time goes on. The more natural stuff you can use, the better it is going to be for your knee. Another question we get is about vibration. Whether there's some people stand on a vibration plate. There's devices out there that you can stand on and it vibrates at a very high frequency, kind of makes your whole body tickle. And then there's tools that you can use that you hold in your hand and they vibrate. Those are also like the heat and the brace, in that if it feels good to use it, if it's keeping you away from pain medications, from going to the doctor to get injections, go for it. It's a investment that's going to be well worth it for you. It can activate muscles, which can help put some stability and some compression, some good compression through your meniscus. But again, if it's not making your glutes work, then it's not going to give you the long-term benefit. The glutes need to get stronger in 99% of knee meniscus problems. And the final question I'm going to cover in this video today is, will massage help? Will deep tissue massage help? Or should I get a Swedish massage? Or should I just do massage on my thigh myself? Or should I use one of those massage guns on my leg? And the answer to that is absolutely yes. It will help with pain relief. It will help with offloading the knee joint. It's not going to help you in the long term, though. It's more of a short-term help, which is great, again, for getting off the pain medications, avoiding injections, and prolonging surgery if you can, or getting rid of it altogether. I would focus on doing it on the quad muscles, in the front of your thigh. Anywhere where you feel tight in your muscles, generally, you should be able to massage it free, and that will temporarily alleviate some of the pressure in your knee joint. But as soon as you go move and do your daily activities again, those muscles are going to stiffen up. Count on that happening, and it's going to recompress your knee. So the way I use massage is, you can use one of those guns. You can go get a massage from a place that offers massage, or do it yourself, or have your spouse do it or something. But right after you do massage is when you need to work on those glute exercises and other related exercises, because that's when your quad muscles are going to be less likely to activate. If you have tight quad muscles, they're stiff and tight. When you go do exercise, they're probably going to be the first muscles to tighten up and be used whenever you're doing exercises, which is going to further compress your knee joint and compress the meniscus tissue inside your knee. So that's the strategic way to use massage. Guys, I hope this video was helpful for you. Please give us a thumbs up if it was. Share it with a friend that needs to hear this. And if you have any questions, drop it in the comment below. We'll get back to it as quick as possible. And don't forget to check out those links we posted for knee meniscus help. And if you're interested in that 28-day program, go check that out as well. Thanks so much, and we'll see you in the next video. Bye-bye.